STI, sexually transmitted infection. Pathogens causing STIs are chlamydia, gonorrhea, herpes, and syphilis. Chlamydia is caused by a typical bacteria called Chlamydia trachomatis. Gonorrhea is caused by Neisseria gonorrhea, gram-minus bacteria. These two are the most common. Herpes is caused by herpes simplex virus 1 and virus 2. Syphilis is caused by Treponema pallidum, which is bacteria. Let's talk about chlamydia first. Chlamydia is an infection of Chlamydia trachomatis. 90% of cases are asymptomatic. For male, untreated chlamydia infection is not likely to cause any further problems, but it is still possible to pass it to a partner. For females, if untreated, it may cause infertility or pregnancy outside of womb. Chlamydia treatment is usually protein synthesis inhibitor. First line is doxycycline for 7 days. Second line is azithromycin, just one time. So second line is for people who are pregnant or not adhering to the first line treatment, which is doxycycline. Chlamydia trachomatis can also cause lymphogranuloma venereum. In short, it is LGV. This is rare, but increasing rate between homosexual anal sex. The symptoms of this LGV is similar to bursitis, burning pain when peeing, odd smelling vaginal discharge, pain, genital discharge. There's also sore or bumps in oral or rectal area. Chlamydia, both testing and diagnosis of chlamydia has increased in past 5 years. 30 out of 40 chlamydia infection in young people are still remaining as undiagnosed. Secondly, let's talk about gonorrhea. Gonorrhea is caused by Neisseria gonorrhea infection of the genital. It is asymptomatic on 15% of men and 80% in women. And gonorrhea can cause pelvic inflammatory disease, cervicitis, urethritis, septic arthritis, and etc. A lot of part of and gonorrhea cases are asymptomatic infections of rectum, cervix, or pharynx. And gonorrhea treatment is causing rectal genital pharyngeal infection, and its first line is ceftriaxone plus azithromycin. Second line to treat gonorrhea is gentamicin plus azithromycin. Second line is usually for people who have beta-lactam allergy. Thirdly, let's talk about herpes. Herpes can also cause genital herpes infection. There are two types of herpes virus. Herpes simplex virus 1 is composing 76% of population. However, it is mainly oral herpes. So for the sexually transmitted infection, it is usually caused by HSV2. It is only a small part, 12% of the total population. However, this mainly causes genital herpes. So 80% of genital herpes is caused by HSV2. Herpes can remain asymptomatic for a long time, even more than 10 years, but it can still transmit it during even in asymptomatic period. For the severe herpes treatment, we can use acyclovir for 7 days, or famciclovir for 7 days, or valacyclovir for 7 days. Lastly, let's talk about syphilis. Syphilis is infection caused by bacteria called Treponema pallidum. Syphilis occurs in hidden part of body, so it is easy to be misunderstood as other disease. It is possible that if you leave syphilis untreated for a long time, it may evolve into neurological damage, cardiovascular disease, or mommy-to-body transmission. For treatment of syphilis, first line is penicillin intramuscular, so benzathine penicillin IM or Procaine penicillin IM is the first line, and if the patient is allergic to penicillin, then alternative is doxycycline PO orally. This is the chart of disease and cause. We can see that urethritis is caused by chlamydia, gonorrhea, and herpes. Pelvic inflammation is caused by chlamydia, gonorrhea. Anorectal syndrome is caused by chlamydia, gonorrhea, or syphilis. Skin rash is caused by the same thing.